Namaste Bitya, Hamesha Khush Raho Bitya. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we are discussing about the various diseases of the hepatobiliary system. In today's lecture, we are going to discuss about the alcoholic liver disease. Alcoholic liver disease are very common these days because of the increased abuse of alcohol among the masses. So what are the various disease conditions that can be observed with the excessive intake of alcohol? This we are going to discuss today. So let's start with the alcoholic liver diseases. In the previous lecture, we have discussed about the hepatitis, different type of hepatitis. We have discussed about hepatitis A, B, C, D, E. Prior to that, we have discussed about the portal hypertension and cirrhosis of liver. So we will be talking about these terms again and again, like cirrhosis of liver, hepatitis, and fatty liver, and all these things. So I just want to tell you through this lecture that we have already covered these topics in the previous lectures. So you can refer the previous videos and the keynotes that are uploaded on the portal for further information. Now let's start with the alcoholic liver disease. Chronic and excessive consumption of alcohol is a major cause of the alcoholic liver disease. So because of the excessive intake of alcohol among the people, alcoholic liver disease is seen in the people. The pathology of alcoholic liver disease, it consists of three main lesions. So there are three main lesions that are seen with the pathology of the alcoholic liver disease. We have fatty liver, alcoholic hepatitis, and cirrhosis. So there are three main lesions. Number one, we have fatty liver. Number two, we have alcoholic hepatitis. And number three, we have cirrhosis. What are the three elements? Fatty liver. So because of alcohol, excessive alcohol intake, the patient can complain of fatty liver. There can be alcoholic hepatitis. And third is the cirrhosis of the liver. Now, what is the etiology? In the etiology, the quantity and duration of the alcohol intake are the most important for deciding about the alcoholic liver disease. So how much alcohol a person is taking, and the duration for which the patient is taking the alcohol is very important. The risk factors includes in men 40 to 80 grams per day of ethanol produces fatty liver. So if a person is taking around 40 to 80 ml of ethanol, it will produce per day. If the patient is taking 40 to 80 ml of ethanol per day, then it will produce fatty liver. If the person is taking around 160 ml per day for 10 to 20 years, then it will lead to hepatitis or the cirrhosis of liver. But only 15% of the alcoholics will develop alcoholic liver disease. So it is not that all the people who are taking alcohol will develop alcoholic liver disease, but only 15% of those will be developing alcoholic liver disease. Now, who are the people at risk? What are the what are the various risk factors that are involved in development of the alcoholic liver disease? Number one, we have drinking pattern. The more likely to occur in the continuous drinker. So those people who are taking a lot of alcohol, continuous alcohol for a very long period of time, they are the people who are more prone for development of the alcoholic liver disease. Gender. Among the gender, the females are more prone for development of the alcoholic liver disease because of their low body mass index. So even if a female is taking less alcohol as compared to their counterpart male, still the chances for development of fatty liver is more among the females. The third is the genetics. The genetics means the genes that are involved in alcoholic metabolism, such as aldehydes, dehydrogenase, ALD, is responsible for the development of alcoholic liver disease. The nutrition, if a patient is taking choline deficient diet, then that particular individual is more prone for development of the alcoholic liver disease. Now, what is the pathophysiology that is involved in development of the alcoholic liver disease? Alcohol, as we all know, that alcohol is metabolized basically by the liver. So 80% of the alcohol that is metabolized to the acetaldehyde by the mitochondrial enzyme alcohol dehydrogenase. So whatever alcohol we are taking, it is most of the alcohol is metabolized exclusively, almost all of the alcohol is metabolized exclusively by the liver and 80% of the alcohol that a person is taking is metabolized to the acetaldehyde by the mitochondrial enzyme alcohol dehydrogenase. The acetaldehyde adducts with the cellular proteins in hepatocytes and it activates the immune system, leading to the cell injury. So what this acetaldehyde is doing is it adducts with the cellular protein in the hepatocytes and activates the immune system, leading to the cell injury. The remaining 20% is metabolized by the mixed function oxidase enzymes of the smooth endoplasmic reticulum. So acetaldehyde, it is addicting to the cellular protein in hepatocytes and it activates the immune system, leading to the cell injury. The remaining 20% is metabolized by the mixed function oxidase enzymes of the smooth endoplasmic reticulum. The cytochrome CYP2E1 is an enzyme. Cytochrome CYP2E1 is an enzyme which oxidizes ethanol to acetate and it releases the oxygen-free radicals. So what this cytochrome CYP2E1 enzyme is doing, it is oxidizing ethanol to acetate and it releases oxygen-free radicals, leading to the lipid peroxidation, which can induce mitochondrial damage. So cytochrome CYP2E1 is an enzyme that oxidizes the ethanol to acetate and it releases the oxygen-free radicals. This is leading to the lipid peroxidation, which can induce mitochondrial damage. Now there is increased gut permeability. Another condition is there is increased gut permeability that causes release of the endotoxin into the blood. So because of the increased gut permeability, there is release of endotoxin in the blood, and this is leading to the release of TNF alpha, interleukin 1, interleukin 2, and interleukin 8 from the immune cells. All these have the implication in the pathogenesis of the liver fibrosis. So let me give you a quick summary of whatever we have discussed in the pathogenesis of alcoholic liver disease. So what is happening in the alcoholic liver disease? There are 3 or 4 ways by which alcoholic liver disease can develop. So number 1, we have the genetic susceptibility. Those people who are prone for development of the alcoholic liver disease are getting the alcoholic liver disease even from the slightest consumption. There are other coexistent disorders like viral hepatitis and hemochromatosis that can lead to the development of the alcoholic liver disease. Another pathway is the acetaldehyde that adducts the immune system, leading to the alcoholic liver disease. Another factor is the enzyme that we have just studied, CYP2E1. Now this increases the oxidative stress and it causes lipid peroxidation and low glutathione that is responsible for development of alcoholic liver disease. Another mechanism of development of alcoholic liver disease from alcohol is the increased gut permeability. This produces endotoxins and Kupfur cells that produces tumor necrosis factor alpha, interleukin 6, 1, 2, and 8. And this causes inflammation and leading to the development of alcoholic liver disease. All this pathophysiology has been given in a summarized and a pictorial form in the e-notes that I have given you in the portal. So just go through that particular e-notes on the portal, and even if you don't understand those things, then you can contact me. I will try to explain these things in the problem solving classes. Now, what is pathological? What are the different pathological features? The pathological features for alcoholic liver disease includes the alcoholic hepatitis. So a patient can present to us in the form of alcoholic hepatitis. There can be macrovascular stenosis, fibrosis, cirrhosis, and central hyaline sclerosis. So these are the pathological features that you are going to see in a patient of alcoholic liver disease. What are the different pathological features? The patient can present with alcoholic hepatitis. There will be macrovascular steatosis, fibrosis, cirrhosis, and central hyaline sclerosis. Now, what are the various clinical features with which a patient can present to us with the complaints of alcoholic liver disease? In the alcoholic liver disease, if it has widened, whenever a patient of alcoholic liver disease is coming to us, the patient can present with a wide spectrum of the symptoms, ranging from the mild abnormalities of the liver function test on the biochemical test to the advanced cirrhosis. So a patient can come to us with the complaints of wide variety or the wide range of symptoms, from the mild to the severe most symptoms. In the mild symptom, there can be slight changes in the liver function test to the advanced cirrhosis condition. The other clinical features includes hepatomegaly and Palmer erythema. This Palmer erythema we have already discussed in the cirrhosis of liver. So the patient can complain of hepatomegaly, that is increased or the enlargement of the liver, and Palmer erythema. The fatty liver presents with right upper quadrant discomfort. So whenever there is a problem related to the liver, then you will see discomfort in the right upper quadrant with nausea and rarely jaundice. The patient can complain of the nausea and rarely jaundice with the elevated transaminases. The alcoholic hepatitis, it presents with the jaundice and hepatomegaly. So alcoholic hepatitis and jaundice and the complications of portal hypertension can be seen. Portal hypertension we have already studied, so you already know the complications of portal hypertension. About 1/3 of the patients die in the acute episode. So the people who are getting acute liver disease or alcoholic liver disease, in those patients, about 1/3 of the patients are dying due to the acute episodes, particularly those with the hepatic encephalopathy or prolonged prothrombin time. So 1/3 of the patient who are getting this particular disease are dying because of the acute episode, particularly those with the hepatic encephalopathy and prolonged prothrombin time. The cirrhosis of liver often coexists with the alcoholic liver disease, and it is associated with fever. Fever can be there, spider nevi. This we have already discussed. I have shown you the picture of spider nevi in my previous lecture. Jaundice and abdominal pain, that's simulating an acute abdomen. The patient with acute alcoholic hepatitis often deteriorate during the first 1 to 3 weeks in the hospital. So if the associated features include fever, we have spider nevi, jaundice, abdominal pain, and simulating an acute abdomen. So all these features will present to the patient as an acute abdomen case. The patient of acute alcoholic hepatitis often deteriorate in the first 1 to 3 weeks in the hospital. Now, alcoholic cirrhosis, it often presents with a serious complication such as visceral hemorrhage or ascites. So the alcoholic cirrhosis can present to us with a serious complication of visceral hemorrhage or the ascites. Now, what are the various lab investigations that could be done in case of alcoholic liver disease? The modest elevation of the aspartate aminotransferase. So we can see the elevation of the aspartate aminotransferase, that is AST, and alanine aminotransferase, that is the ALT, and gamma glutamine transpeptidase. So we can see the elevation of AST, ALT, and GGTP. There is hypertriglyceridemia and hyperbilirubinemia that can be seen. So we can have hypertriglyceridemia and hyperbilirubinemia. The hypoalbuminemia and coagulopathy are common in the advanced liver injury. In the advanced liver injury, we can get hypoalbuminemia and coagulopathies. Ultrasonography is useful for detection of the fatty infiltration. So a patient can go for USG for detection of the fatty infiltration, and prothrombin time and bilirubin are used to give a discriminate function to assess the prognosis of alcoholic hepatitis. So in the investigation, we can check for the AST, ALT, and GGTP. Hypertriglyceridemia and hyperbilirubinemia may be seen. Hypoalbuminemia and coagulopathies are often in the advanced liver injuries. We can check for the ultrasonography, and it is useful in detecting of the fatty infiltration. Prothrombin time and bilirubin are used to give a discriminate function to assess the prognosis of alcoholic hepatitis. Now, how to manage a case of alcoholic liver disease? The most important thing is to stop the alcohol consumption. So you have to ask the patient to stop the alcohol consumption immediately. And then we have to treat for the complication of cirrhosis, such as variceal bleeding, encephalopathy, and ascites. So we have to treat for the complications of cirrhosis that are seen in the patients, like variceal bleeding, encephalopathies, and ascites. Good nutrition is very important in such patients. So we have to give adequate and proper nutrition to such patient. Corticosteroids in severe alcoholic hepatitis is given to reduce the inflammation. And in advanced cases, liver transplantation has to be done. So the management consists of cessation of alcohol consumption, treatment of the complications of cirrhosis such as variceal bleeding, encephalopathy, and ascites. Good nutrition is very important, and corticosteroids in the severe alcoholic hepatitis. And liver transplantation in the advanced stages has to be done. So this is all about the alcoholic liver disease. I hope you have understood this session properly. I have given the e-notes on the portal, so you can also download the e-notes and you can see what I have taught to you in today's lecture. In the next lecture, we are going to discuss about the non-alcoholic fatty liver disease. So this is all for today. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you have understood the session properly. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.